Again, bizarre is not the right word, but we see it, don't we? So, do you want to tell me more about your client that you just mentioned earlier, and I'll tell you about mine?
Yeah, so unfortunately, she didn't come to me for cancer originally. This patient of mine, her son and I have been friends for probably close to 30 years. And he just said, Mom's not feeling good. Her doctor told her everything was fine, sent her home, and she just wasn't feeling good. And after listening to her symptoms, I decided to run a few cancer markers, even though they didn't sign up with me with oncology, and she lit up like a Christmas tree. And so, immediately that same week, I had her admitted into the hospital and she had stage 4 lung cancer. And it just was an uphill battle because it had already started impeding in the organs. And about 8 weeks into it, actually, it was after our last podcast. You and I chatted briefly, and I was telling you that she really wasn't getting nutrients in, and you were like, I would advise getting a feeding tube. So I had it all arranged. Everything was arranged for her to get a feeding tube, and I was so hopeful that once she got the nutrients back going, she was going to become alive again, just like you talked about.
Hmm.
And unfortunately, she wasn't stable enough to get the feeding tube when she got into the hospital. And then the doctors really rallied for her to have radiation. And unfortunately, about 2 days after her first radiation treatment, she passed away.